the more we engage middle management in compliance and giving them specific responsibilities, the more vested they are in the compliance program, and then the more valuable and effective that program is.
Hey everyone, welcome to another episode of Operator Insights. I'm Kendall Harold, and today we are joined by Matt Tormey. Thanks for being here, Matt.
Happy to be here, Kendall.
Happy to have you. So, Matt, you have more than 20 years of compliance experience, but it hasn't always been in healthcare. I want to talk to you a little bit about your background and how you got into the healthcare field.
Sure. Kendall, I started my career as a lawyer back in 1990 while I was waiting to get into the FBI. Got into the FBI in 91, spent from 1991 through 1999 with the FBI in New York, and I started my healthcare compliance career on January 2nd of 2000.
Wow, so how does one make that transition from the FBI into healthcare?
Interesting transition, but it actually makes a whole lot of sense. Mm-hmm. The CEO of the company that I joined was looking for somebody who had a law degree, so a legal background, and somebody who could do research, legal research, could write well, and can conduct investigations. So those are obviously skills that I had developed and I went to school for, and met the CEO, met the leadership of the company, and it was a really good match personally and professionally.
So what was it like, I guess, from a professional standpoint, taking that turn from doing exciting FBI cases into healthcare?
So it's not the same type of excitement.
Right.
You're not getting up at 4 o'clock in the morning to go do a search warrant or execute an arrest warrant. But the excitement came from what was ahead of me. So my opportunity was to build a compliance program because they were pretty new for the healthcare industry. They really came into place in the late 1990s. The first OIG compliance program guidance for hospitals came out in 1998, so it was still really new for the industry. And what that company wanted me to do was take what they had built, and they had put together the foundation following the OIG compliance program guidance, but they needed me to really fill out all the different pieces of it, the 7 elements of the compliance program. So it was a great challenge for me to understand how to do that, to learn how to do it effectively, and I learned a lot by starting at the ground level and building a program. Learned a lot throughout that process. So it was exciting. It was a different type of excitement, and the older I get, the less excitement I need.
That's great. Well, when you came to Ensemble, you also had the opportunity here to really build the compliance program, right?
Absolutely. So I came to Ensemble at a unique time, and part of the reason I came was because of this opportunity. So Ensemble was previously owned 100% by Mercy, and when I arrived, we were acquired by a private equity group, and now we had to create our own standalone compliance program. So there was a compliance program previously, but it was under Mercy. So now my opportunity was to build a standalone Ensemble compliance program, which we've been doing over the past almost 2 years since I've been here.
And what goes into that, especially for not just a healthcare company, but a healthcare company that's growing as quickly as Ensemble is?
So there is great guidance out there from the United States Sentencing Guidelines, from the Office of Inspector General, from the Department of Justice in terms of what's expected to be in a compliance program, what those foundational elements are. But that's the easy part, right? That's the paper part. We always hear the saying, did you have a paper program or did you have a real program? And there's a lot to that, right? You could have a paper program that checks all the boxes, but it's ineffective. So that is your starting point, but how you design and implement that program depends on what business you're in, where you're located. Are you spread out geographically? What type of services you provide, the leadership. So you have to take all that into account when you customize the program to meet your needs. And that's the tricky part, right? It's how to do that right. And one of the things that I've learned over the years is, 1, don't try and do it on your own. 2, it's not necessarily a top-down approach. I think the most effective approach is really a bottom-up approach. And what I mean by that is companies that have had issues in the past, some companies, right? What you hear is the compliance program was something that most people, and we did training once a year, and it
Right.
wasn't much more than that. What I've learned through my experiences is that the more we push compliance down to middle management, the more effective it's going to be. And what I mean by push down, and that might not be the right term, the more we engage middle management in compliance and giving them specific responsibilities, the more vested they are in the compliance program, and then the more valuable and effective that program is. And so one of the things I started to do when I got to Ensemble is meet the different leaders, from the most senior leaders down to the middle leaders, and understand what they were doing, how they were doing it, why they were doing it, and then think about ways that we can integrate compliance into that process. So at Ensemble, what I did was I replicated things that we've done before. And I give all leaders throughout the company, I developed a policy that gives them specific compliance responsibilities, and we monitor that. And that really makes a difference, right? Having a policy is one thing, that's the paper piece,
Right.
but are you engaging in regular conversations about, okay, Kendall, how's everything going? Have you been talking to your team about making sure they're getting their education done? What quality assurance audits are you doing? What are you doing with the results? And that engagement really makes a difference. And then what we've done at Ensemble is, and which I've done elsewhere, is in addition to your executive compliance committee, which is your executive leaders, we created a compliance advisory group, which consists of those middle management leaders. And there's one representative from each functional area. So when I was with the health system at the hospital, we had your representatives from lab, HIM, radiology, all the different areas was on that compliance advisory group. I'm doing the same thing here at an Ensemble, and they help me design policies and procedures that make sense for the company.
Right.
They help me, give me suggestions with regard to what education we need and how we can make it more interesting. So my greatest attribute is recognizing I'm not nearly the smartest guy in the room, and I take full advantage of the really smart people I have around me to help make the program effective.
That's great. So we've talked a little bit about the how. I want to talk about the why. Why is it so important for an organization to really have a robust compliance program?
So let me give you an example. I come from a family where my brothers sell restaurant equipment, and part of what they do is they entertain. They want people to become their clients. They want them to remain their clients. So they take them away on great ski trips, fishing trips. They give them nice gifts, and that's all okay. That's part of their business. But in our business, that may not be okay. And I always ask this question during training: why is it okay for my brothers to do that, and the people that I work with, why can't we do it? And the difference is the majority of healthcare in the United States is paid for by the state or federal governments. And the state and federal governments have created rules and regulations that govern the things that we can do and the things that we can't do, from your basic coding, billing responsibilities to how we interact with potential referral sources. And their concern is that they don't want organizations doing things that would improperly induce people to use a particular provider, and also activities that would drive up the cost of healthcare, because those costs, the salespeople aren't taking that money out of their pocket, right? They're getting it from the company, and those costs are typically passed along by an organization in terms of their charges and fees and things like that. So the why is we are in a highly regulated industry, and compliance programs help our associates understand what the laws, rules, and regulations are that we have to comply with, and the consequences of what happens if you don't comply with those laws, rules, and regulations. And the most simple examples are, one, there could be a major investigation, and that takes up time. It's a distraction from providing good services to your patients and the other people that you serve. And it could result in fines, it could result in penalties, and if it's really egregious, it could rise to the level of criminal conduct where people could go to jail.
Yeah.
And then the last piece is the death penalty, right, for organizations. So if you do something really bad, the Office of Inspector General has the ability to exclude you from continuing to provide goods or services to Medicare or Medicaid patients.
Wow. So the value, I guess, for our clients when they look at Ensemble and look at the robust compliance program that we have, how does that really translate to what they're doing, I guess, on a daily basis?
That's really important, and I get asked that by prospective clients. How does that work? Even by new clients, they want to know, well, how does that work? So having been from the hospital side, I understand at the end of the day, the bills that go out are the responsibility of the hospital, right? It's going out under their provider number or the physician practice. They shouldn't change a thing, right? They should still do the quality assurance reviews, the internal audits that they do, the coding reviews that they do to make sure that we, as their partner, their business partner, are doing things correctly. That shouldn't change. I did that when I was on the hospital side for vendors that we engaged. What we bring to the table is we complement, right, what they do, or we supplement what they do by what we do, right? So we have a whole bunch of quality assurance coding audits, for example, that are taking place on a regular basis for our new coders that are coming on board, our coders that have been on board for a long time. So we're doing regular coding audits, we're doing regular training that occurs, right, based upon the results of the coding audits. That also happens in the billing side and other functional areas. So we are an added layer of protection that builds on top of what our clients are already doing.
That's great. So really valuable to them as well.
Yes.
Awesome. Well, Matt, in your opinion, what does it take to be an effective compliance professional?
So compliance is it's a tricky profession in the sense that part of what you do is when you investigate wrongdoing, but that's only a part of your job. Another part is to advise people on things that they can and cannot do. So in my experience, like any experience, right, whether or not there's good doctors, there's bad doctors, there's good lawyers, there's bad lawyers, even in compliance, right, it's hard, it's difficult, and you're faced with a lot of situations, you're faced with a lot of questions whereby people are looking for answers. And sometimes it's easy just to say no, to be 100% risk adverse, say no, you can't do that. One of the things I learned throughout my career and in my first compliance job where we had hospitals throughout the US is I was able to learn as I visited the different hospitals about the different ways that things were done. And so what I was able to do was, if I had a question, Matt, hey, can we do this? And it was obvious they couldn't do it. I was able to not just say no, but no, you can't do it that way, but would you consider doing it this way? Perhaps you can do it this way. And the ability to do that really, it gained goodwill with the operators, it gained trust in me that they can come to me for not only can I do this, but advice, could you think of another way that I can do this legally or within the requirements of the regulatory guidance? So that's a really important quality for compliance officers, is to be able to give alternatives. And if you don't know it, to be able to say, you know what, I know you can't do it that way, but let me look into some other options, and then have the ability to do some research or make some phone calls. So that's one attribute. And then the other is the ability to trust, right? I mean, you have to be able to trust your compliance officer to be transparent and honest, and communicate when they have concerns in what I characterize as a very neutral way. It's easy to get emotional about things and alarmed, but if a compliance officer gets emotional and alarmed, that makes everybody else get even more emotional and alarmed. So to be able to communicate and deliver information in a honest, straightforward, neutral way is another really important criteria. And then the last is overcoming the impression, because compliance has a connotation that you're internal affairs, right? You have to overcome that, and it's up to you, right, to overcome that or to make it worse. And if you make it worse, you're building a wall as opposed to building a bridge. And part of our job is to build bridges, because you don't get information unless you do build bridges. So that ability to network and build bridges is going to open up doors so you get information sooner rather than later. So you get information about a little problem before it becomes a big problem. So that ability to provide alternatives, the ability to be straightforward, the ability to be neutral in terms of your personality, those are three really important criteria for a compliance officer, in my opinion.
That's great. Well, I want to ask you one last question. We like to wrap up these episodes with kind of a fun question to get to know you a little bit more. So your question, Matt, is if you could give advice to your 18-year-old self, what would it be?
Whoa, after working for 30 years?
Yes.
My advice would be, to myself, would be work as hard as you can to become as good and smart as you can at what you do. Be nice to everyone and network as much as you can, because you can learn from everybody, and you never know when your paths are going to cross again. And I've been very, very fortunate throughout my career that I believe I've treated people fairly, I've treated people respectfully, and it's come back to really benefit me throughout my career. And I'll give you a quick story if you have about how
absolutely.
that's worked out. Is so when I left the Bureau, we had phase 2 of a takedown that took place a month or so later, and they're all organized crime guys. And I met all of them because I brought them in at one point in time or another for subpoenas and to do certain things. And when they took down the crew, some of the guys were asking, "Hey, where's Agent Tormey? Where's Agent Tormey?" And my coworkers had told them, "Oh, he went to the private sector. He wanted to, take care of his kids and his family, make a little bit more money." And their response was, "Hey, good for him. Good for him. Tell him I said hello." So even the worst of the worst, right? If you're good to them, you can earn some respect.
That's a great story and great advice. Well, thank you so much for joining us today, Matt.
Kendall, thank you. My pleasure to be here.
Really great to talk to you. We'll be on the lookout for more Operator Insights.